Okay, thank you, dear colleagues. Good afternoon to everyone. It's our great pleasure to welcome all of you to today's Women of WoEUPSA webinar. It's our third webinar, and we would like to introduce you today our distinguished guest, Professor Sabine Sarnacki from Paris.
Hello.
I would like to give a short introduction. It's actually a very long career path with lots of accomplishments and many things to be mentioned, but I will try to briefly summarize her most striking accomplishments. So Professor Sarnacki is the head of the Department of Pediatric Surgery in Necker Enfant Malade Hospital in Paris. She is involved in pediatric oncology since for the past 25 years, and she has a very, very strong interest in neuroblastoma. We know her all very well from her neuroblastoma publications and studies. She has headed the surgical committee of COPAN for 8 years and was a member of the International Pediatric Surgical Oncology IPSO Group Executive Committee between 2015 and 2019. She was vice president of the second French National Rare Disease Plan between 2011 and 2016, and also led a national reference center on rare colorectal diseases. She has a long experience in research, and this research is in many fields like transplantation immunology and enteric nervous system development. She was the president of the French Society of Pediatric Surgeons for the last 4 years. She created the IMAG2 laboratory associated with the Imagine Institute, dedicated to computational anatomy in pediatric tumors and developmental diseases. This project is also associated to a robotic program that was initiated 7 years ago. Professor Sarnacki has published extensively. She has more than 250 publications with an H index of 39. And she also has contributed into many pediatric surgical textbooks internationally and nationally. She also has had many PhD students in her training who train under her, and many residents who are now have become worldwide distributed and recognized. Very importantly, she's not only recognized internationally so well, but nationally, she has been given the Légion d'honneur, which I think is a very important French, accomplishment appreciation by her government. And also, she has recently been elected as the Dean of the Faculty of Medicine for the University Paris-Cité. So please, all join me in giving a warm welcome to Professor Sarnacki, who will be talking about pediatric surgery as a woman beyond stereotypes. So thank you, Professor Sarnacki, again for accepting our, invitation. We know you're very busy, and we would like to ask you start off with actually how you chose to go into pediatric surgery. Who inspired you? Who were the people who inspired you?
So first of all, thank you very much for the summary of my career, because sometimes I have the impression that it's somebody else. You are speaking of somebody else than me. Okay.
No, that was
it. So I was I fall in love with pediatric surgery. I was I think 22. It was my first or second residency as a medical student. It was in Hôpital Trousseau in Paris, because the chief, the name was Max Gruner. He was a fantastic man. He was doing it. It's interesting because he was doing mainly oncology, pediatric surgery. So, the circle is closed now. And this man, I don't know why, because maybe because he was somebody who loves really the children. He was very he play with them. He was very nice with them, and also he was maybe because he was not making any difference between women and men. Um, when I left his department, and then I came back as an intern for the internship, I told him, you know, Professor Gruner, now I will be a pediatric surgeon. I was very happy to say that I will be a pediatric surgeon thanks to him. And he told me, you know, Sabine, you will never have the quality of a man, because he was joking a lot. And I told him, yes, but I will not have the default.
Very good.
And he was, you know, I like to say that because some sometimes now the women, they don't understand that some men are like that, you know, they push you, but it's not, they are really nice. He was really nice with me. He helped me a lot when we were in the operating room. He wants me to learn, and he was really, he pushed me a lot. But when you speak with him, sometimes you can think he makes some difference between men and women. And it was not the case at all.
Mm. Mm.
I mean, the contrary was true.
Mm.
And then I came to Necker Enfants Malades, first to Bicêtre, where I was ready to work there. But when I came to Necker Enfants Malades, I discovered the research, because Professor Révillon, you know Professor Révillon, he was doing a research program on small bowel transplantation. And it was really fascinating because it was the beginning of the first program of intestinal transplantation. And you know, the first program of intestinal transplantation was in children, not in adults. So I was fascinated by the fact to do some research about that. And that's how I began to do research on immunology of transplantation, and especially of small bowel transplantation, because, you know, it's a very difficult transplantation on the immunologic point of view. So, and then I stay finally in Necker Enfants Malades, where I'm still, because it was very rich for research, and I like very much to mix both. I mean, I like very much surgery, but I think I was not ready to do only surgery. I was very interested to work with people with different disciplines, and that's why if you see my publication, I always work with people who are doing biology, immunology, development, and now I'm working with radiologists and engineer. I like this mixing of disciplines.
Well, I would like also to say to the people who are listening to us that Professor Sarnacki wants to have a very interactive, more like a interactive talk with us. So she wants to this afternoon or this hour to be inspirational. So please, even if it's only Gonca and me who can ask the questions, please ask your questions in the chat. So we will read them out for Professor Sarnacki, so we can have an interactive session, inspirational one. I have actually a question, because of course your CV is incredible and your career is amazing and all your achievements, but I would like to ask you, what have been the main barriers during your career? What have been the main obstacles that you have to, you know, overcome and climb?
So we will speak of the problem of being a woman. Okay. Because at this time, it was because I am old. And at this time, it was particularly difficult because when you go in any of department of surgery, you were the only woman, always.
Mm.
So it is a difficulty, but it is also, and I want to stress this point, it is also something that helps you to be better, to be always good, always rigorous. Usually when I arrived in the department of surgery, I was the only woman, the only as you say, intern, you say?
Yes.
Not fellow, I mean before fellow. And when you arrive in this place, everybody look at you and say, what she will do, what will she be able to do? And so my aim at this moment was to thinking, I will be perfect. I will do my job in a way they cannot criticize anything, at least for the first months, 6 first weeks. And then people say, oh, okay. They began to think that you could be a good collaborator. And you know, the men, they like to have women around them. So you can benefit from that, because if you are very good, if you are very professional, and I think it's very important to be professional. I mean, never try to enter in a relationship with people around you, especially men, that can complicate the way you want to be, that is to show what you are able to do. You are a woman, you are a man, doesn't matter. You are very good, very professional in your job. And my mentor, Madame Fekete, Professor Fekete, we have to speak of Professor Fekete, because I think she was the first woman with Madame Leca, who was a surgeon, a cardiac pediatric surgeon, Francine Leca, who deceased a few years ago. They were the first women in surgery in France, and professor. But they were very professional. And I think it's very important to stress that for young pediatric surgeons. Be always very professional, because you need to be like that to show that there is no, it's not why you are a woman, you are a man, you are black, you are white, you are yellow, whatever, but you are very professional and very rigorous, and you have to work a lot, that's all. But I think finally, yes, it can be, you can leave it like something difficult, but I think it's finally something that push you to be better.
Do you think there are some personality traits, character traits that would be important for women in pediatric surgery? How can they balance their, private life and workload? Because I think it's the same for men also. It's not just women, but sometimes work and private life cannot be easy to balance. How did you overcome that problem, or how do you advise the young generation with that?
First, it's difficult for any woman who wants to have a very important invest in her profession. But surgery is particularly difficult because you have this long day, and you are in duty. You have the mental load to operate children, because I think now it's more, maybe more something that differentiates you from other people to operate children. It's a mental load very heavy. But I have to say, and to be true, it's very difficult to make the balance between your family life, your private life, and your work life. It's very difficult. But excuse me. And I have to say that I am now with the father of my children. We are together since more than 40 years. And I am very proud of that. But you have to know that it was not always easy. there was some period, very, very difficult period. So everybody asked me that. I think first you have to choose somebody to live with, could be a man or a woman, doesn't, this is the same thing, that lets you admire, that somebody that admire you and that lets you live your own life. That are able, that is ready to say, okay, she wants to do that, she do that. She wants to, she come late in the night because she was with a family or she was in the war. No, it's not a problem. And I think that that's why you have to choose somebody who is ready to accept that. Because if it's not ready to accept that, you cannot do that. I mean, if the fridge is empty, it's not a problem, you know. And you have also to have somebody who accepts you to spend money to help you. I mean, to have somebody to clean your house, somebody to help you with the children. So you will spend a lot of money. And I calculate that
then you
I
need to get
spend,
help. That's another thing, right?
yes. And so it means that the person you live with is able to say, okay, we will spend money for that. And somebody who I think who respects you. I think the respect is very important, because if you live with somebody who respects you and who wants you to be happy, he will tolerate many things. And even if it's not easy, because it's not easy. And I want to stress that it's not easy. But with time, you know, everybody is finding his place in the couple, because it's what is difficult. And finally, I think the children are, for me, it's very important, because the children helps you to, when you come back home, so you let all your problem at hospital, even if you are very tired, and your children are your, I used to say they are my, comment on dit les moteurs en, they are like, you know, the fuel for my body, you know, they nourish me, they help me to overcome difficult situation. I'm sorry, because my English is not so good. So I think you need to have, to be able to compartmentalize your life, at least when the children are young, because they need you. And it's difficult to do everything, but I think if you are not able to have a proper life, and I saw many young women that are so, I mean, so keen to have a good work, to be good surgeons, that they just forgot their own life. And I think it's a very huge problem, because with the age, you get very rude, you get very hard, and you are not able to, I think the children gave you some flexibility. They give you some sweetness.
We have one question from Polona here, that she writes that, yeah, perfection is often in our specialty, but there are expectations that to be always perfect, and that expectation can be a burden too, especially if you also have a family with the long working hours and private life and so on. So there is a difficult balance to maintain. And it's very important, like you're saying, the support from the family and the social network is very important. But her question is, how did you achieve to be active and aiming to perfection, both in surgery and research? Because both takes the same time of dedication. How do you find that balance?
I will respond to this question. This is a very important question, but I just want to say the perfection. Once I met Madame Fekete, you know, in a corridor, and I was just exhausted. And I said, "Oh, it's terrible." And I can begin to speak of my problem in family, my problem in the hospital. And she told me, be careful. Don't try to be perfect everywhere, especially some things like, but it's difficult because perfection is our specialty. And I think in women, especially women, we like everything very well. We like that everybody is happy around us, and we like that everybody is at his own place. Everything is very well organized. But sometimes you have to let it down. And so it's very important. Some things you have to say, okay, it's not me. I let somebody else to do it. This is important and not very easy to do when you are used to control yourself and to control everything. That's why the children are very important, because they make some trouble in your life, and they make you I mean, more able to relax on some point.
To get perspective.
Yes. And regarding research, and we are control fix sometimes, okay. And research and surgery. I have the chance, because it's a chance, to have a chief like Madame Fekete, who understood very well, very, very early and very well, that in a department you need to have different kind of people. Some people are more invested in pedagogy, teaching, some more in surgery, some more in technical skills, some more in medical aspect of our disease, and some more in research. And at this moment in Necker Enfants Malades, there was nobody doing research in my department. And so she understood very well that I can be these people to invest in research. And so she pushed me to do it. But the question is, can we do it at the same time? And it was the subject of my medical thesis, whose name, the title was Surgery and the Surgeon and Research. Yes, and it was Madame Fekete who pushed me to do this medical thesis. And I think, and I did a presentation in WoEUPSA a few years ago. It was when it was in Paris, to say that I think that you cannot do both together at the beginning. It's not possible. You need to do either only surgery, because if you want to be a good surgeon, you need to see many, many, many cases to be exposed. And you need, when you do research, you need to be focused on that, because it's a new job, you don't know it. You need to be to change your mind in this way of research, where you criticize everything. You read a lot, you plan your research, you ask for grant to support your research. It takes time. You have people to work with you. I used to have every year to have a young surgeon to do a master, and it helps me a lot also to do research, to have a master every year. But it means also that you invest a lot, because when they arrive, these young people, they know nothing. I mean, but you have to do both separately at the beginning. I think this is my do surgery, then you stop. You do research. You know, in USA they do the contrary.
That's what I was going to ask. In the US, they want to go into research first, then surgery. Which one would you advise? I mean, what's your opinion?
I don't know. I think that to do surgery first makes you more comfortable with the idea that it is what you want to do. But I think, never mind, but you need to do both separately. And then when you are good in both, then you can mix.
Mm.
But I don't think it's a good thing to try to begin and do both at the beginning when you are not quite familiar with surgery.
Mm. Mm.
Another question. You are like invested a lot of your time with your publications, research in neuroblastoma. Why neuroblastoma? What was so fascinating about it? Because with children's, we have many tumors. Why not Wilms tumor or some other tumor but neuroblastoma?
I think because I work, at the beginning, I was not supposed to do oncology. But Madame Fekete told me that's why the mentors are very important. Because you see, since the beginning, I spoke of her maybe 4 or 6 times. Because she was very key to help me, to guide me in my career. And she told me, you have to do oncology. Because at this moment, oncology was done by everybody in the department and finally was not very well done. So she told me, we need to have somebody specialized in oncology. And to say the truth, there was another woman in my department who was Hélène Martelly, who retired since a few years, but she was invested also in oncology and then moved in another hospital. So I decided to do oncology. And when I discovered oncology, it brought me something I didn't find in pediatric surgery, which is the way to analyze the case and the way to think chemotherapy first, surgery first, discuss with the radiotherapist, and because it's multidisciplinary by essence.
Mm.
And the oncologists, they learn me a lot. They learn me how to discuss the case. They learn me how to do the research, clinical research on that topic. So it gave me a lot of, intellectual aspect. It is very intellectual. And then came as I did a lot of immunology, I understood very well when the aspect targeted therapies, immunotherapies and nana came. It was something I was able to understand. And neuroblastoma, because I think maybe because of Jean Michon, maybe, who was in Curie and who gave me a lot of cases like that at the beginning. Then Gustave Rossi gave me also. And then I began with that. And to tell you the truth, I operate this patient and do my surgery report myself. I used to do it myself, not to detect. And then I discovered that the anatomy of the neuroblastoma was not the same. I did cluster of patients.
Mm.
And maybe because I did my report myself. And doing my report myself, finally at the end, I say, oh, this patient is the same as this one, but it's very different from this one. And and since the beginning of my training, of my activity in oncology, I did a registry, and now there are about 3,000 patients in this registry. Because each case is interesting. Each case is interesting. And you have to take time for each case because it gives you much more information than just the surgery. And that's why neuroblastoma is fascinating, because you have some patient that at the beginning, after birth, this neonatal, perinatal neuroblastoma will regress, that regress spontaneously. and at the other part of the spectrum, you have the high-risk neuroblastoma with a very bad prognosis. And then in between, we have all these prognosis factors. We don't know exactly which is the biology is the most important, but not only, because we did this work on the correlation, but for example, between biology and anatomy. But you know, the oncologists were unable to do that because they don't know the anatomy. So I just enjoin you to try to benefit from each case. Each case is interesting.
I have another question. Considering, I mean, your if you can look into retrospect and all your experience and the experience that gives you also to see over time how our specialty and society has been developing. Do you feel like today, 2025, and from your position, do you think there's still a glass ceiling for female pediatric surgeons in Europe? Do you experience that, or do you think we have overcome that?
I think that, you know, now I am the dean of the biggest university, the biggest faculty of medicine in Europe, I think. I think they asked me to take this job because I am a woman. I'm sure, because you know, it was the tendency. Okay, so I was very much hesitating to taking this job because I like very much my surgeon, I mean, life. But I took it because it's the end of my career, and I say maybe it's interesting to bring something new in the management of a school of a faculty like that. And what I see, to respond to your question, is that when I met now people coming to visit me to have a position in my faculty, and we know we have now we have 850 university people in this faculty and 600 resident fellows. So it's a huge. So they come and ask something, and some of these men, they are still completely. They don't like that a woman say no, it's not possible. I can feel. I said that I feel
Even
like
in
I
France.
was young because I have the same problem to overcome than I did 30 years ago. So it's not finished. Because I think it's imprinting, you know, imprinting, it's epigenetic. And I think this imprinting is so huge that it will be difficult to, but it will be difficult to overcome that. But what I want to say, and there is this question from Neil, is that you don't have to fight in the sense that sometimes the men, they don't just realize, because it's in their gene, it is in their epigenetic. So if you don't have to be rude, you just have to show that you are able to do the same thing, that you think differently, and maybe, and also to accept that sometimes men bring you something you don't have. So it's, you know, a department with only women is terrible. Did you saw that? It's terrible because we need to have this balance. But it's sure that when you say surgeon, the people imagine a man first, but you see in few years there will be no more men in this job. Yes. Now I have a problem to find, because they say you have in my system now, they say you have to have the same number of men and of women in any committee you do, okay? But the problem is to find men.
Mm. Mm.
So I think this is something that will disappear.
Mm.
And but I think that the main problem will be to balance between the family life and the work, whatever the work. Because if you work in industry and you have 2 hours travel to go there to work and 2 hours to come back, and you have 3 children and nobody to help you, it's worst, much
Mm.
more. And you are doing a job you don't like.
Mm.
So when you have the pleasure to do a job you like, it's a chance.
Mm. Mm.
Professor Sarnacki, now we probably have young surgeons who are following us today. What would be your advice for young people who have just started their training or are, you know, junior in their training about how they should plan their pediatric surgical career? You are looking now from a long time perspective, and you have young people around you. What do you advise them?
I think first, you have to wonder what you want to do. And this is something young people, and it's not their fault. They have sometimes some difficulty to know exactly what they want. And I think it's very important to challenge yourself. What I want to do in my life. This is the first question. Some people, for example, I have a daughter with now the last one, because the oldest one, the last one is 24. And she told me, I don't want to do, because she was terrified, I don't want to do a medical study. I say, no problem, no problem. But just ask you what you want to do. And if you know what you want to do exactly, which is important, because if you say, I want to do an academic career, and then you say, it's too difficult for me, it's not a problem, but just change your way and say very, very early, don't wait to have 40 years old, just change. And you can say, okay, it's not for me, I try it. I want to do, pediatric surgery, just only surgery and care, because I don't want to do research, I don't want to write paper, I don't want to go to the Congress. Okay, no problem. You will be a very good surgeon and very helpful for everybody. Everybody has his place. But it's in the life generally. Just know what you want to do, and when you know exactly what you want to do, then give you the means to do that. And this is difficult. I know this is difficult because sometimes the circumstances, your family, the place where you live, etc., can be difficult. Sometimes you have to adapt to your circumstances if you cannot. But I think what is the worst is to try to follow a way which is a chimera, because you don't you don't take the good choice, you don't have the good choice, and you just say, I want to do that, I want to do to be professor. Okay, but to be professor, it means several things. And are you ready for that? If you are not ready, this is not a problem. But don't try to be a professor and you are not doing what you have to do for that. I mean, research, academy, paper, etc. You agree with me?
Oh, yes,
Really,
totally.
right.
Totally. First of all, you have to know yourself. You're right. And try to see what you're capable of. And feeling successful in life, I think, gives you a positive reinforcement
Yes,
about your career.
exactly.
I
You
agree.
you tell
They
you
go
tell
side
much
by side.
much better than me. It really is that. Really is that. And there is another thing very important is to take time for you.
In which way?
You go to shopping. Sometimes I go shopping and have a new dress. I was very happy for all the day or for all the week because I thought that I had done a good surgery and I was very happy for that. And I said, oh, okay, now I deserve a new dress.
Okay.
No, but it's little things, but very important.
Rewarding things.
Yes, to have this positive reinforcement and
Yes.
not always be this is like you balance between your professional and your personal, but you balance also in the day, in the week, between some times that are very difficult. You are in the surgery, in the OR, you have a very difficult patient, it bleeds, you don't know how to go out of that, and it's very, very stressful. So you have to find 2 days or 1 day or 3 days after that, a moment where you are more relaxed, where you can restore yourself. I think it's important, but there are some coach who can help you for that.
May I ask you, is it anything you would have done differently? Is it any decision, any choice, anything that if you could go back, you would have done differently?
No.
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 Mm.
No, maybe what I didn't do, but because it was not, at this moment, it was not so easy, is to go to have a period out of my country, I mean abroad, to do research or to do clinics. But it was not easy at this moment because you have no internet. I have, at this moment, I had 2 children. My husband was also doing his career, so to find a place where both of us can work, and we didn't have money because I come from a very modest family, so we didn't have any money to do it very easily. So it was difficult at this moment. So it was difficult for me because it's why my English is so bad, because I was not, now you have the series on YouTube or whatever, on the TV, you can learn English when you are a child, when you are a child, a teenager. At this moment, it was not possible, and in my family, it was not a culture to send you in another country. And they didn't have money anyway. So this is my only regret, because English, it was difficult to speak English in the Congress, and it was also very difficult to write English. Now you have ChatGPT and whatever, so it's not a problem. But at this moment, you have no tool to do that, and so it was difficult. Maybe it is my only regret.
We have a couple of questions in the chat now. Unfortunately, I don't know who the question belongs to. There are the initials, but she says, having a supportive husband helps balancing a personal and professional life. This is crucial when you keep teaching and training. But doing research is even more time demanding. In most lower middle income countries, we need to work in the public and the private hospital to earn enough money. Most women usually work at the public hospital because being in 2 places will sacrifice family life. This seems to be a disparity in our context, since usually our male doctors the ones who do both practices. So any comments on that? That's question number 1 that I can see.
So thank you for the comment. It's a very important comment because my vision is a vision from a very, I mean, high level income country. But I know that is much more difficult in other countries. So, and also the vision of the woman are different. Not only in low middle income country, because if you discuss with women in USA, they told you that they are also put away in many things. But I think that it's difficult to change the mental the way to think in a country of all a country. So maybe you just have to try to see to make a group between women that are in the same difficulties and try to see what you can do together. And with now with the Zoom, with all this kind of communication, it's maybe something you can set up in your country to try to know how you can manage this, and also to try to influence your own chief, because in few years, I don't know if your country, Lily, but in few years there will be only women because the men they are quitting the difficult job like that. They prefer to have job easier and with much money. So it's difficult for me because I don't know exactly your situation. I cannot take your place. This is what is difficult to give counsel, but maybe to try to do a group between people that are like you, and to try to think how we can maybe at the beginning just favor one woman with like a grant, and then 2, and then 3. I will begin like that. I don't know if I respond to your question.
Do you remember your single most difficult case? Was another question, technically, or from a psychological aspect. Do you have this one case that follows you, or?
I have had some very yes, I have complication. Like everybody. I can tell you, Madame Fekete used to say sometimes when I had a complication, she told me, Madame Sarnacki, the only week where I have no complication is when I am in holidays.
Very good.
So keep it because it helped me a lot, this kind of sentence. So yes, I had some complication with some neuroblastoma, I have a patient who is living in Greece. She sent me every year photographies because she was operated there for alveolar abdomyosarcoma of the pelvis, and she had radiotherapy and 2 attempts of resection there. And when I operated her, I just forgot that she had radiotherapy. It was difficult, but it was, I dissect the iliac artery, and I didn't thought that this iliac artery received radiotherapy. And she did a thrombosis of the iliac artery. We were obliged to do the thrombectomy, and and she had then a problem with her leg, but she's walking, but she had some difficulties because she had, aponeurotomies and the muscles, etc. And then she had a problem with the rectum, and she had a stoma, and then we do the pull through. And now she's maybe 15, 16. She's doing dance. She's a very good at school, and she has a normal, she's continent. So and I have other cases like that. So I think this is what is interesting is to, in surgery, what is the most important thing is not the surgery itself, because when you are in the OR, usually you know exactly what you have to do. The most important is to prepare your surgery and to take all the aspects of the case and to anticipate the complication you will have, because then when you have the complication, you know how to deal with that. And so, but sometimes even when you prepare everything, when you think to everything, it doesn't go as smooth as you want. I just want to underline that this is inherent to our work. We have to accept that. I think the worst is to have a complication, and to have this complication because you didn't take sufficiently time to analyze the case and to prepare your surgery sufficiently. And it happens to me also. And this is maybe the worst case because it's my fault.
We have a professor from Algeria, Suham Touabti. I apologize if I did not pronounce well. She says that she only has female residents now, interns, and so that she says the future belongs to women. So that's something that is, again, I think a common trend.
And so please, I speak to this surgeon from Algeria. Please do better than men. Do better. Please. Because I have many patients coming from Algeria, very difficult case, because usually the men, and she will understand what I say, are very proud. They don't want to say, I did bad, or I think bad, or maybe I don't know, I will ask to somebody else, or I will go to an adult surgeon to help me for a difficult or special case. Please do it. Don't hesitate to ask, to say, I don't know. It's not a problem.
One of our, again, questions is about when you have young children who are in their developmental years, any advice on quality time management for you and the children? How did you tackle that problem when you were tired, or maybe you were out of surgery very late?
So I had the chance to have a nanny. She deceased last year from breast cancer with metastasis, but she was with me since the beginning and stay with me, and then she took care of my grandchildren. You know, it's beautiful. And she was like a part of the family. And I think that most of my career, I own to her. Yes, I own to her because she was really fantastic. And so after that, the children, they are not very complicated. You have just to be careful when they need you. And sometimes they give you some signal, but you are pediatric. So you know the children, you know how they give you some signal sometimes. And what I used to say to do, don't tell it, when I was a resident or fellow, sometimes I felt that my children need me. Not so long. I mean, afternoon to take them to the garden or to have an ice cream or whatever. And what I did in this, when I was very tired and it was difficult, I phoned to the hospital and I said, you know, I am ill. I cannot come today because I am ill. It was not true. And I didn't do it very often, but when I feel that my children need me, and that this day I slept a lot, and then I went to the school, take my children and say, okay, today we are doing that. And it was sufficient. It was sufficient. So I think you need to be very sensitive to what they can send you. And if you have a husband that is very nice, and now the young men, they are nicer because you can see when you do your consultation, you see father coming alone with a child. It happened, at least in France. If you have a husband that is very nice, so he can also help you in this way. But at this moment, my husband, he was doing nothing at home, nothing. Now he's doing something.
We have another question in the chat, because you're advised to be kind with people around you, people you work with, but how do you face people that are arrogant? Not only men, I mean, whoever who treats you with arrogancy, how can you bear yourself to keep on being nice? What is your advice there?
This is a very good question, because sometimes the women, because we need to fight to get our place. Okay, so we used to be, and I was also like that, to be a little rude, to try to take our place, and especially if somebody gives you some bad signal, you are even ruder. I think you have to not to take any bad word that are given to you. Don't take it for you. You can do like that. It's for me. Not for me, you know. Not for me. It is somebody who tell you some bad words because maybe himself is not in a good shape, he had some problem at home or whatever. So I think if you take some distance, it's easier to respond correctly. A few months ago, my daughter is anesthetist. This is the only way she find to tell me to make a revenge, you know. She is an anesthetist. And she phoned to me and she told me, you know, Mom, thank you very much, because you learned me how to take distance, not to take this, because the surgeon who came to her, he was disgusting with her. And people around her were very shocked by the word of the surgeon. And my daughter, she say, okay, it's not for me. It's because he's afraid of the surgery he has to make. You know how you can be. And so she said, okay. And then when the surgery was smooth, she said to the surgeon, okay, you are better now? And so I think you have to it's Julia. I see Julia is getting. Hello,
She
Julia.
asked the question.
So I think you don't have to take anything personally.
And will you ever stay in a department that you are not uncomfortable? What would be your advice?
Excuse me?
To stay in a department that you are not comfortable or that make you feel uncomfortable, what would be your advice? How do you fight that?
To go in another place. I think you don't have barrier. The barrier are the one you make yourself. You know, I was nominated as a professor, as a academic people, not professor, before professor, very late. I was 39, 40. And at this moment, it was difficult for me to have this position because of many things. And I went to a private clinic in Paris and say, okay, I will do circumcision, appendectomy, and whatever. It's not a problem. It's not a problem. It's better to do something. Maybe at this moment I will be rich because I have a big clinic, private clinic, and I have money much more than now.
Mm.
But the thing is to be able to adapt.
Mm.
People don't want you to work at this place. So, okay, you go another place. But you have to anticipate. It
Mm.
means that you are not like just waiting. You anticipate. If you
Mm.
can feel that the place is not good, just begin to try to see where you can go to do something else.
My question is for, again, the young ones. To be persistent, I think, is the key for our, success in surgery. It's for everyone, women, men, but persistence. When should you give up? When is the time when you say, I tried my best, but now I have to give up? Is that, or should you push a little bit harder yourself? Because I think sometimes generational, there are differences. No discrimination against any generation. It's just the differences. Our generation had different, aims that we need to achieve. Now this generation has different ones. So what is the kind of limits? Where should you say, okay, I should stop here. I tried my best.
So for the new generation, now I have about 5,000 students.
Yeah, that's why I'm asking your
All my children, I
Huge.
told them, you are all my children. I think this is difficult for them. We have to understand them. Because when I began my study, it was, everything was pink. Everything was fantastic. The last few weeks we had with this completely disturbance of our world, it's difficult for them to project in the future. And that's why they have not the same way to think than us, because the environment is different. And so we have to understand that. It took me a long time to understand that we cannot think like when we were this age, because it is not the same world. So I think that what you mean is that, do we have to, because maybe we can think that now they are more easy to say, okay, I give up, it's too difficult. Anyway, it depends what you want. If they are able to say that, it means that they don't really want that. And if they really don't really want that, they don't do it. Maybe they will regret. That's why what is the most important, and I told that in a talk where they asked me the question of women and the most important is how you raise your children. Because finally, it's when you are a child that you receive this message. Okay, you don't want to do that, it's too difficult. Okay, don't worry, it's not a problem. You can do something else. But if you do something else, give you the mean to do it. Just don't give up after 2 days or after 3 days, because but it is not when you are 35 or 40 years old. It is when you are a child that people give you that. No?
There is a question again,
Yes.
Carmen, about
Yes.
yeah.
Do you regret to choose oncology? And did you also do surgeries on non-oncological patients? I guess you did.
I did, before doing oncology, I did a lot of non-oncology. I do not so much urology. I am able to do an hypospadias, but I was able to do an hypospadias, but I will never do it anymore because it's not fair for the child. But I did a lot of neonatology. and colorectal also because of the reference center on anorectal malformation. So I did both, but progressively I did more oncology. No, I didn't regret. It's fantastic families, because you know in oncology it is life or death. So it's these families are easier than families with malformation.
And somebody's curious to know, how old were you when you defended your thesis? Like 18?
No, you mean the thesis medical?
Yeah. Yeah, your PhD, I guess.
Maybe medical, and we can also ask your pediatric surgery.
Yeah. PhD.
I mean,
PhD,
PhD,
yes.
PhD, I was 34.
Yes. Yes.
Again.
But I benefit from research was very important to have babies. Because
Oh.
yes, because
you were not doing calls. Maybe.
yes. So I did 3 full years of research after my, I did it after my 2 first, how I did it, I don't remember. I think I did 2 years of fellowship and then stopped to do research. And so it helps me to care for the children, because you don't have, I did call to get money and to be in the course, but it was easier to organize me the research. That's why, but I had some grant for that. And now I think it's much more difficult to get grants at this moment.
Thank you very much, Professor Sarnacki. What a lovely afternoon chatting with you. It's been truly, truly inspirational. I think I speak both for me and Gonca and everybody who has been listening to us. I think I count at some point up to 47 people in the chat, but we have been steady over 40 during this time. So it's been amazing.
Okay,
time to chat.
I hope it helps you, because you know it don't. I think you understood. It's not because I don't want to push me in. I mean, it's not to speak about me, because it's not interesting me. What is interesting is that what I can give you to believe in you, and to
Inspire them.
yes, to give you some means to do what you want, because what is important in your life and your children, my children, I think they are very, they told me that it's better to have a mother who is very happy in her work, even if she's tired, even if there are some moments which are very, very difficult, but globally, than to have somebody who is not happy with his life all his life. And it's better to have, and I finish with that, to have difficult moments when you are young, because you can bear it, then you have good moments than the contrary.
Thank you so much. Really.
Thank you so much.
And I hope I help you, and I thank you very much for the invitation, because it's very nice from you. And sorry for my bad English. Now you know why my English is bad.
It was
We are all
perfect.
not
Perfect.
English-speaking countries. We all have our little
Yes.
difficulties, please. Thank you again, really, Professor Sarnacki. I'm sure the video will be also will be on the YouTube website of WoEUPSA. A lot of people who could not join in will be following this.
Okay.
Thank you.
Bye-bye.
Thank
Bye-bye.
you, everybody who's been listening and asking
Bye-bye,
questions.
Julia.
Thank you, everyone.
Bye-bye.
Thanks a lot.
Bye-bye.
Bye-bye.
Yes.